Looking at the NuVision device. NuVision is an artificial intelligence holographic testing protocol that utilizes 17 servers around the world and takes the person's information as a data point and throws 130,000 items at that person. Whatever sticks, it ends up prioritized on this device with 95% accuracy. So, for example, we can look at allergies and sensitivities. So the colors denote intensity. You can see purple means acute and intense, whereas yellow means chronic and less intense. Here's another great thing about this product. We can click right on it and it takes us right to Wikipedia or to the web.
Oh, interesting. Wow.
So this one is eyes and upper airway. And we can dig deeper, and we usually encourage the patient to do that. Okay, now we get into the clear here, clear circles. These are a lot less intense. So we're looking for patterns. We don't want to get lost in all the details.
And how often does this change? Like, say you were going to do, this was what, 6 months ago?
Well, no, this is today.
Oh.
Because we just brought you up.
Oh, okay.
We can go back and compare to 6 months ago.
Yeah, but how often do you recognize that it changes drastically, or that?
Well, there's certain things that are transitory, like sinus congestion or sore throat, but there are other things that are not, like if someone's on a trajectory for, let's say, liver cancer, that's not going to change very quickly.
Okay.
Or Lyme disease, right? All we can do is, because if you have Lyme, it may show up on NuVision until the day that you're dead, but as long as we can keep symptoms suppressed, then we're doing our job. You're not necessarily going to eradicate, quote unquote, many of these problems. But if you're asymptomatic, then who cares? Okay, so the reason that dental, we bring that up early, is it's so important, is that each tooth is actually a fuse in a photosynthesis or fiber optic fuse box for a meridian system. For example, tooth number 11, eye, knee, hip, mid-back, gallbladder. So if we're having any trouble in any of those areas, we need to rule out root canal tooth infection first, right? So again, we want to look for patterns. So I can see sinus, jaw, knee, right? So 15 and 14. So if you're having any challenges in those areas, we may need to look at the tooth first.
And how do you know if it's the tooth is the cause, or the area that it represents is causing an issue?
That's an excellent question. It may not be the tooth, but as long as we continue to see the patterns, we may have to come back to the tooth. That's why we come here first.
But it's, in a sense, bi-directional in that what affects the tooth also affects that area?
Yeah, for example, let's say someone had a surgery through a gallbladder meridian on the IT band. That's going to compromise the energetic flow to the gallbladder, even though the gallbladder itself might be whole and healthy.
Okay.
Right?
Yeah.
So we need to address that incision before we bother with the tooth. But keep this in mind, 95% of cancer patients have 3 or more root canals that are infected.
Wow.
So they pull the teeth, the cancer goes away in many, many cases.
Interesting.
So it's that critical. Okay, let's look at traditional Chinese medicine. So this is going to show us what the meridian flow looks like in your body. So here we have internal nose point, which goes along with some of the sinus things that we've been seeing with the teeth. So if you were to spray the nanoxide in there 5 or 6 times a day, that would be an excellent start.
Okay.
To have the silver begin to coat that massive surface area that we have in the sinus. Okay, again, pattern recognition is what we're after. We're not getting lost in the details. So we can see abdomen, bladder, kidney, bladder, kidney, governing vessel. Okay, let's look at spine. So you can see the value of the device for any medical professional wanting to narrow down their parameters of testing.
Right.
Okay, so mid-back comes up for you, just like we saw with the teeth, right? T9, T10, T11.
Yeah.
And then jaw. But everything is clear other than the top one. So
And are all those, even the ones that are clear, are they listed in order of severity?
It's in order of severity. And again, this isn't a replacement for proper imaging. What it is a precursor so that our imaging choices are as refined and logical as possible.
Right. And have you done testing for the NuVision up against like thermography and other testing to see how they correlate?
When the blood work has been done with NuVision in the beta testing, there was definitely corroborating evidence.
Okay.
Also, thermal imaging does do that, as well as GDV.
And what is GDV?
That's gas discharge visualization, Kirlian photography.
Oh, that's Kirlian. Okay.
Okay. So in terms of intensities, here's brown, which means chronic and intense, and then yellow, which is chronic and less intense. Overall, your nutrition looks pretty good here. Okay, see this? Heavy metal detox.
Okay.
And we'll find out what that is as we go. In particular, what the heavy metal is, because certain metals need certain chelators to work properly. Bentonite clay, recommending. MSM. Let's look at pathogens and toxins. Ah, there it is.
Cadmium.
You have cadmium poisoning. Ascaris, this is a worm. Let's see what this virus is.
Do you recommend turpentine for that? Or?
Turpentine is safe and has a long track record. It was actually in the Merck manual up until 1910.
Oh, wow.
The person to research for that is on YouTube, Dr. Jennifer Daniels. And the place to get it is diamondgforestproducts.com. I've been on it for a couple of years now.
And that takes care of most parasites?
It is definitely one of the top candida solutions. So this is interesting. If this were me, I would definitely be on the nanoxide product to deal with this virus. And then we need to get you on a chelator for the cadmium. We're so poisoned from so many different angles that what I recommend is that people, even if they're healthy, just think about every day, what type of detox am I doing? Am I on a chelator? Am I on some type of natural antibiotic every day? Oregano, all of these things are very safe. And what I like to do is just tell people to continue to cycle so that we're knocking down that pathological load, knocking down that pesticide and heavy metal load, right? Rather than waiting for the train to crash and having to fix everything once it's too far gone. Okay, this is called energetic cellular release. This is what your body is attempting to detox first. Looks like you might have picked up an infection from a dog. Oh, it's a treatment for canine heartworm.
Oh.
Interesting. Did your dog have heartworm?
Dog I had when I was a teenager. And I remember getting it on me.
Really?
Trying to get it in her mouth, and she wouldn't swallow it.
Can you believe that? How long ago was that?
That's a while ago, yeah.
Can you believe that this device picks that up?
Wow. Interesting.
So yeah, that's still poisoning you. And you can see the cadmium again. So once again, pattern recognition. The only reason that anything is on this device is that your body is either screaming for it or it's screaming at it.
Is it unusual to have it come up twice in the same?
No, that just shows that it's intense, right?
Oh.
Here's the cadmium, right?
Yeah.
Third time we've seen it because it's the first on this page, for example.
Oh, yeah.
Right? So we have to honor that. So people who are cautious, I say go ahead if you want, go ahead and have a cadmium test. But if you're smart, you'll not spend the time and money, and you'll spend that money on getting the cadmium out of your body because it's there. Okay, vestibular system, this is your balance from the head trauma. So I would recommend light therapy and PEMF continually for the head.
Have you ever used the light therapy that uses you clip it in your nose and it's using the light pulse? And what do you think of that?
I think it's got huge value. The fact that most of the blood from the body comes through that area allows you to treat globally, even though you're treating locally. There it is again.
Wow. 3 times.
Yeah. Now this is Hannah Kroger's synopsis page, or summary page.
And Hannah Kroger was
she's passed away, but Hannah created a database, one of the first in the West, of herbology, homeopathy, Eastern methods. Okay, see, it's recommending glutathione, right?
Mm-hmm.
The master antioxidant, but also a tremendous chelator.
It looks like there's quite a few things. Is this normal or to have such a
Well, there's 130,000 that are summarized down into what we see here.
Wow.
So again, we don't want to get lost in the details, but we do want to look at the patterns. Okay, here's another summary page. And this should be available in a smartphone app within the next year or so. So you can imagine.
The accessibility would be.
Oh, look at that. You have a stomach ulcer.
Huh.
H. pylori. Sodium again. Okay, now along with cadmium, we had lead toxicity. See that?
Yeah. So as you bring this into a phone app, then people will test themselves, or.
Mm-hmm.
And I think another question people have is, how does this device picking up on me specifically and not you right now?
Well, because there's a triangulation created with your name, place of birth, and date of birth.
Oh, I see.
It's unique to you.
Okay.
So, for example, we have clients all over the world. We were able to figure out that a gentleman in Ecuador was poisoned, and we were able to figure out what the poison was and do that over the telephone.
Wow.
That happens quite often. So it's all about using the power of the hologram and artificial intelligence for good, rather than messing with us for a change.
Yeah.
Okay, so there's thyroid. Here's total lipids again, right?
Uh-huh.
So we definitely want to take a look at your fat intake. Are you doing coconut oil daily?
Yeah, but maybe not enough, huh?
And also the best source of fats is algae. So maybe we want to change your brand of algae.
Okay.
Okay, you're on track for kidney stones.
Purine?
Yeah. So you're too acidic. And part of that comes from the electrolyte imbalance, right?
Yeah.
As our electrolytes increase and become proper, then we become alkalized. So the pH is actually changed by the presence of the metals.
Interesting.
Okay, there's kidney. Now again, it's in yellow and it's small. So think of this as a GPS for your body. What it's telling me is that your boat is headed for the rocks. It's not there yet, but what it allows us to do is make a few degrees course correction to get your boat into smooth water, rather than the Western system waiting for your boat to crash on the rocks and then coming in and picking up the pieces.
Yeah, I'd rather not do that.
Okay. There's some scar tissue from a surgery. Where would that have been?
The most recent was on my lip from a mountain bike accident.
Okay. So there might still be a low-grade infection in there. Okay, see, the lead and the cadmium are affecting your thyroid function.
That's what it is, huh? Okay.
And then the fifth one down, the EFAs. We really need to take a hard look at getting your fats squared away, because the fats actually are the most important macronutrient.
Yeah, right.
Because they create hormones, right? It's how we make testosterone, progesterone, estrogen.
It seems like a lot of these guys are talking about how important it is to start getting the body more into
Ketosis.
ketosis.
Yeah, but if you listen to Ray Peat, RAYPEAT.com, who's 80 years old now, is a brilliant biochemist, he doesn't feel like it's safe to be in ketosis for too long.
So you should cycle through.
Right.
And what is this? I see spiritual voodoo, witchcraft, spelled negative intent.
Yeah, that's beyond my pay grade, but there are people who are experts in dealing with those issues.
Okay.
Now, that could be from a hospital procedure, it could be from a curse from an old girlfriend, or a family miasm, right, that persists throughout the generations.
Interesting.
Again, it's way beyond my pay grade. I'm into 3D, things that I can touch and move. Okay, there's dehydration. Now, I'm pretty intuitive after working with athletes for 30 years.
Yeah.
It's obvious that you're an athlete and that you're drinking enough water. The reason for the dehydration is because of the electrolyte.
The sodium, yeah.
Right. Because what happens is water that has electrolytes becomes sticky, if you will. It wants to stay. Water that is in an electrolyte depleted situation just kind of flushes through the body and isn't utilized by the tissues properly.
And can be harmful, right? Because then you flush more minerals out if it's not absorbing.
This is supposed to be gastric, by the way. So,
okay,
because you do have an ulcer, you have the ulcer bacterium, the H. pylori. And then let's see what it says about cardiac asthma here.
That doesn't sound too good.
Well, it's in purple, which means it's potentially transitory. It's not chronic.
Okay.
Okay. And then you only have one.
And if it's chronic,
okay, you have PKU. Interesting.
Okay.
This is phenylketonuria who have trouble absorbing the amino acid phenylalanine. So this can be created, unfortunately, by NutraSweet or aspartame.
yeah, I don't.
And I'm sure that you don't, but
Right.
it might be sneaking into your life through gum or drinks or some type of powder, right? Or maybe in the past, and your body's still dealing with the
Maybe
effects
that-
of the NutraSweet.
Yeah. Huh.
Here's traumatic shock. This is probably some of the head trauma.
For therapy for head trauma, is it PEMF or?
The PEMF is always going to be choice number one, followed by light therapy. And there's no substitute for corrective work, whether it's craniosacral or Rolfing or someone who's well versed in those things.
And that, like the healthiest people you see, do they have like a very small list of things or?
Well, everyone's going to have the same length of list,
Oh, I see. Okay.
but some people come up with this whole page being clear, for example, clear circle rather than having the colors.
Oh, okay.
So we don't get too concerned about those. Okay, here's the Royal Rife page.
And these would be frequencies then?
Yeah, so this is priceless for folks with a Rife device. The reason being that the biggest weakness in Rife was diagnostics.
Yeah. Which is what he had the microscope for, right?
Right, but who has a microscope and who's going to take the time to draw their blood? And
Yeah.
remember that as the magnification changes, you're getting into whole different pathologies, right? So if you're looking at viruses, which are tiny, you're going to miss the bacterium, which are large, and so you may completely miss the frequency that you need. This
Really-
is much more elegant.
His was really unique too, wasn't it? That they haven't been able to duplicate.
Right.
Yeah.
In fact, a friend of mine has access to the original Rife equipment. So it's being taken care of now and actually utilized. As
Oh,
we
awesome.
speak, so that's
Wow.
pretty exciting. Okay, let's look at another Rife page. Yeah, you definitely have a gut infection.
And the turpentine and the silver or the N-oxide would take care of the gut infection? Or?
Those would be the two best choices that I can think of. Okay, there's fluoride. We need to get that out of your life too. It's affecting the thyroid and the
Yeah, I don't use
adrenals.
fluoride toothpaste. I don't use.
Right, but you're showering in it. And
I have a filter though. But I guess it doesn't. Shower filters don't take care of the fluoride, do they? Just the chlorine.
No one that I know takes out the fluoride with a shower filter. Okay, let's look at new medicine. This is Dr. Hamer's page. Dr. Hamer from Germany. Now, this has to do with how the brain is processing insults to the rest of the body. Okay, interesting. So, number one, this is from your training to strengthen the musculature for further strain. So your brain is comfortable with that.
Mm-hmm.
But look at number two. I believe that you may have had some damage during a concussion to the portion of the brain that has to do with dealing with water,
Oh, okay.
right?
Interesting.
Intracellular versus extracellular, how much to hold on to versus how much to eliminate, right? This is actually a fascinating study to go into his work, and he spent time in jail for it, so we know that he was on top of it.
The more progressive they are, then.
Exactly. Okay, let's look at some solutions here. Here's a homeopathic page.
Huh.
So, again, you don't have to focus on all of them, maybe the top 3 or 4 or 5.
And the squares and the circles, what does that mean?
That has to do with subconscious versus conscious.
And so typically when your patients, you would suggest to do these homeopathics for just by one bottle's worth, or how much would you have to take this stuff?
Well, what we would do is maybe focus on the chronic issues in the brown and the purple, or the intense issues, I should say.
Okay.
And then retest in a month or 6 weeks and see what comes up.
And you see a lot of them will clear up in a month, or?
Oh, yeah. As long as there's other aspects being dealt with as well, like the nutrition and some of the detox. Okay, so let's look at, here's a psychology page. This is planetary healing.
I'm blocking belief.
So you're benevolent.
That's good to know.
And fuming.
At the same time.
And you like the sound of Om.
Yeah, that's true.
So we know that everything has an emotional causality. Just like everything going on the planet has a spiritual causality, right? Everybody wants to talk about what's happening in 3D, and certainly that's important for us, but to be able to look at what the real true root causes are, rather than the branches on the tree, but the roots of the tree.
And it always starts energetically first, right?
Right.
Yeah.
And what I've found in 30 years of practice is that trauma resolution and emotional resolution are really number one.
And what do you recommend? EFT or Rolfing or?
EFT's fine if you're at home and you want to save some money, but it can be cumbersome. I think the most powerful therapies are the ones that utilize discussion along with something somatic. So the body is being touched. Whether it's acupuncture, whether it's pool therapy, whether it's toning with chakra bowls or
Forks.
tuning forks, right? And someone who's got a real heart, particularly I find females, for males,
Yeah.
for therapy, someone older, someone more nurturing. Very powerful things can happen, and people can overcome some of these traumas in one session. And the devices are fantastic, but there's no substitute for discussing it with someone and having them touch you in a nurturing way.
So cranial sacral would be probably a great.
Yeah, my favorite that works for me is the pool.
Oh,
A warm pool while you're in water and you're actually doing the psychotherapy while you're being Watsued, if you will.
oh.
Right.
So you just float and they kind of hold you and. Oh, okay.
People like David Sawyer in Boulder and AnnieBrook.com. People like that.
And that
Very
therapy is
powerful.
called pooling?
Well, it's somatic water therapy. There's also a woman
People
in
do.
Boulder named Sylvia. I can't recall her last name right now, but she uses tuning forks and gongs and chakra bowls for a very profound trauma resolution experience while she's actually working on your body.
Wow.
Really neat stuff. And, you know, it's all about, if you're baking the perfect cake, it's a whole bunch of ingredients. You leave one out and the cake is ruined. So
Yeah.
we need to, the beauty of NuVision is that it allows us to leave no stone unturned. You know, it may be 6 months or a year before people get it, and they come back to me and they go, oh, what was that, homeopathic again? And they start taking it and boom, they get better, right? The one piece that they left out.
Yeah.
So it's a journey, and that we can't expect everyone to make instantaneous changes in every area. But what I tell people is, let's just choose one or two a week that you're going to tackle. Whether it's the purchase of supplements or the visiting of a practitioner or the purchase of a device that's going to help change things. It's all about voltage, as we talked about. We've been taught that everything is a chemistry problem. That's only partially true. It actually begins with the voltage. So as we raise the voltage, many of these problems begin to fall away. It's amazing what I see with world-class athletes, for example, who can just continue to perform through the most heinous types of infections and adrenal weaknesses and things like that. The body is very resilient, and when people have a will, they can overcome a lot.
Right.
But at a certain point, the will loses to the pathology or to the heavy metal, and so ultimately needs to be dealt with.
So the psychology can't override the physiology for too long.
Right. As much as we'd like to. Although I do believe, and what I'm seeing is that because of all the toxicity that we're dealing with, I think that the human DNA is so malleable and so profoundly geared towards survival that it's actually modifying itself to deal with the modern filthy environment, if you know what I mean.
Yeah, evolving in a way.
However, there are certain things that you're never going to overcome, like fluoride or cadmium. The willpower loses to the reality of the physiology at some point. But we know what to do, and we have safe detox methods now.
Yeah, fortunately. And the number one for, you were saying for cadmium, probably
Well, it would be a cocktail.
of,
So super sulfur,
okay, yeah.
the glutathione that we talked about, bentonite clay, and we would try those first, but if those didn't do the job, we would get into EDTA with heavy duty chelation therapy.
And the concern with EDTA, there's something,
Well, it messes with your electrolytes, which
Okay.
you're already having a problem with.
so that wouldn't be a good
So-
first choice.
No. I think long term you'd probably be all right with what we're talking about.
Okay.
But let's give it a try, and we'll retest in 6 weeks or so. The good news is we can do it on the telephone.
Yeah, that's great.
And remember what happens with the heavy metals, right? The body forms a fat pocket around the heavy metal to protect the body from having to deal with the toxicity of that metal.
Right.
So it's not like the cadmium is affecting your IQ, obviously, or your focus, your ability to form words and thoughts and to be motivated, right?
Yeah.
However, when you're on a long bike ride and you're using some of those fat stores, guess what? Some of that cadmium gets
Gets
released,
released.
and boop, guess where it goes? It goes right to where you had the head trauma, because any place where we've had a physical trauma becomes a protonically charged entity,
Huh.
right? Where the body wants to be negatively charged. So anytime we have a protonically charged area, it becomes like Velcro or glue to every miserable thing that we put into our body. It goes right there.
It's like magnetic, huh?
Right?
Yeah.
Here's an
Now
example.
it's functional,
See
but
how,
I do have an injury here,
this
and
needs more
so
swollen
whenever I'm a
than that.
bad boy eating something I'm allergic to, like I'm gluten intolerant, but I love my cheeseburger every now and then,
Guess what? The knee starts to hurt. Doesn't go to the left knee because this is negatively charged. This one has plus charges on it. This is what arthritis is. People want to blame the injury, but it's not just the injury. It's the injury plus the combination of the gut. Leaky gut syndrome, for example, leading to those molecules actually ending up in these areas of injury, creating calcium, creating inflammation, and next thing you know, the joint is either locked solid or too inflamed to function. And now you're looking at replacement when we could actually have healed it energetically in the first place, potentially.
Yeah, this is so great that you can actually, get it in advance before everything starts manifesting.
So in a perfect world, I would combine what we're doing here with thermal imaging, which is where we're headed, just so you can see, right?
Yeah.
Imagine if you could see your head and your thyroid and say, oh, wow, interesting, okay. And then we retest and we see the change in color, as opposed to all of this left brain, Dr. Spock kind of thing.
Yeah.
Right.
Yeah.